The California Center for Reproductive Health was founded several years back. It is one of the veteran clinics in this part of Los Angeles. The vision in general has always been around the idea of personalized care. We have patients that have failed multiple prior treatments and are coming in a desperation mode to seek additional care. And for them, it's a failure coming in to get advice and to get treated. You have to recognize that element when you're treating the patient. You have to understand what the patient is going through, who the patient is in front of you, and what they're about to go through, which is also very stressful and oftentimes may lead to a fantastic, great success, but the process in and of itself may be extremely stress-provoking. So we'd like to have patients coming into a very warm, very friendly, very stress-free environment. It starts with how the office is set up. It starts with how the patients are greeted by the staff. It starts with these basic elements that really lower the stress and allow the patient to be in an environment that's more conducive to having a success. The key factors to a successful, healthy pregnancy for the California Center for Reproductive Health has been personalized care and using innovation and professionalism, meaning employing safe and proven fertility treatments to achieve a successful outcome. That combination of factors has translated into superior success rates year after year. We feel that the field is constantly changing. Innovation is constantly on the horizon, and one has to adopt this kind of innovation to be able to treat the patients with up-to-date treatments that are proven safe and effective. The nature of what we do has resulted in treating patients that are older and older, and that's because demographics are changing. Women are having children at later stages of their reproductive life, and that has become a challenge for couples trying to achieve pregnancy and for the clinics like ours that are administering care. The innovation in the treatment has translated in treating patients that are older slightly differently than younger patients. It has to do with the types of stimulation protocols that we employ today and some of the techniques we employ in the IVF lab as well. And that has resulted in superior success rates for the practice. The clinic has grown over the years. We have now adopted the services of Dr. Irene Wu, and she has been wonderful because she's compassionate. She cares about what happens with the patient every step of the way and has translated to excellent outcomes for us.
At a smaller clinic like ours, we can really go through each phase of the evaluation, the diagnosis, and the treatment for each patient. Infertility is a very stressful and discouraging journey for a lot of patients, and I think it's not always a positive result, and I think a success is really that the patients feel that they've gone through the best that they could and that they've really looked through all the types of possible treatment outcome for them, and that is, to me, a success.
From intrauterine inseminations to in vitro fertilization to third-party reproductive techniques such as gestational surrogacy and egg donation, we pride ourselves in giving patients a gamut of choices for their fertility and reproductive care.
We've now really developed the technology to freeze eggs, and we do it through a vitrification method now, which is flash frozen. And these eggs are able to survive. There's more and more studies that show that clinical pregnancy rates, live birth rates from these frozen eggs are just as good as embryos. So this has opened the door for a lot of women to also come through and electively freeze eggs to protect their future fertility.
Our particular clinic prides itself in being able to offer patients who have tied their fallopian tubes in the past such treatments as tubal reanastomosis procedure or tubal reversal procedures. Many IVF clinics have abandoned that surgery in favor of IVF. IVF, however, is a much more involved, much more expensive treatment option for those patients. So patients are appreciative of the fact that options are given to them. They empower the patient who needs to be empowered here so that they can make sensible decisions about their reproductive care.
As more and more couples are having fewer children, the idea of family balancing is important. And we've actually looked into this in our clinic because we believe it's really important to help find ways to improve patients' outcomes. So one of the things we've looked at internally is to find a way to sort the sperm.
The vision for the clinic has been to grow through personalized care that's innovative and on the cutting edge. And I think it goes without saying that if these are the ground rules, if you will, for how we treat patients at the California Center for Reproductive Health, the center will continue to evolve and grow as this field of medicine continues to grow and evolve. We will go with the flow in order to be able to administer the best possible care in the safest possible manner, in the warmest and friendliest type of environment.